Hello, so this is a oncotic pressure addendum based off the talk that was just given for oncotic pressures. Now, we talked about what it is, what it means, and now I want to do some correlations with pathology and some disease states which actually relate to oncotic pressure. So this is not just physiology, it's not just something you learn in physiology. You can actually apply this to a lot of diseases. Okay, so the first disease I want to talk about is something that you all probably heard of. It's really prevalent in third world countries and countries that have a lot of poverty in them, and it's called kwashiorkor, right? Okay, now what's this? What do these children especially look like who have kwashiorkor? Swollen bellies, right? Swollen belly. Now, why are they swollen? Well, if you think about what is kwashiorkor's syndrome, what it is malnutrition. Okay, it's where these children don't have any protein in their diet, and when they don't have any protein, they don't have the amino acids to build albumin, so they don't have any albumin. So, in patients with kwashiorkor, what do you expect their oncotic pressure to be in their blood vessels? Low. Okay? Patients with kwashiorkor have low oncotic pressure just because they don't have the protein in intake. They can't make albumin, so they'll have low oncotic pressure. So if they have low oncotic pressure, where will the fluid go? Into the interstitial space. It won't stay in the blood vessels. That's why these children, when you look at them, they have really big bellies, right? And it's just all fluid built up there. They're not well fed, it's actually just fluid built up. And when you have fluid and edema all over your body, what is the term for that? Anasarca, right? Okay. That's actually the term for fluid edema in your lower extremities, upper extremities, everything like that. Okay, all right. Now, the second disease state, let's talk about very common, diabetes, right? And if you think about all the organs that the diabetes affects, one of them is are your kidneys, right? Okay. All right. Now, what do they actually do to your kidneys? Well, it's basically all of the glucose, the hyperglycemia, glycosylation, damaging your renal arterioles, all your glomeruli, and doing all sorts of things there. Well, what is it causing? It's causing damage to your glomeruli and causing a loss of protein. That's why you see, what do you see? Microalbumin urea. You see albumin in your urine. If a diabetic patient has albumin in their urine, that means that their diabetes is affecting their kidney that much, okay? So this is another, a disease state that basically causes loss of albumin, in the urine. Now, is this enough to cause anasarca? Not really. Most diabetic patients with nephropathy don't get anasarca, but this is just one example of a disease state causing loss of albumin and thus lower oncotic pressures, but not really that significant. Okay, now let's talk about the third thing. Again, this is kidneys. Okay, what is that disease where you have inflammation of the glomeruli? Simple, right? Glomerulonephritis. Okay, now more specifically, there are two types, right? Nephritic and nephrotic, right? And of course, there are differences in these, which we'll talk about in another lecture, but let's focus on nephrotic. Nephrotic is a really big loss of protein. I think about more than 3 grams in the urine per day, okay? And if you're losing 3 grams of protein every day in your urine, what would I expect a patient with nephrotic syndrome, what will their oncotic pressure be? Low, right? Because they're losing all of it in the urine. Okay, all of the protein that's coming through is just being lost into the urine, into the the pelvis, pelvic the ureters into the bladder, just going out into the urine. Okay, so they have low oncotic pressures. That's why patients with nephrotic syndrome have the the periorbital edema. You always notice that in questions that they always mention, oh, this like 9-year-old child has a periorbital edema. That's just edema around the eyes. They can have anasarca as well, but they usually talk about periorbital edema in questions. Okay, so again, another disease state where you have loss of protein causing low oncotic pressures. And if they ever gave you a question where they ask, oh, which of the following A, B, C, or D, which of these disease states would you expect a low oncotic pressure in? And you're thinking, well, I have no idea. Well, just think about it very simply. Think, what is oncotic pressure? The amount of protein in your blood, right? So just pick which of these options has anything to do with low protein. And I bet you nephrotic syndrome or something will probably be there, okay? Now, the next one. We always talk about, low oncotic pressure. Well, what about higher oncotic pressure? They rarely ever talk about this in questions, but, just to give you an example for theoretical sake and just for theory, what's one disease state which will give you higher oncotic pressure? Well, I think, well, what would give me more protein? Well, albumin's a protein, but there are not a lot of diseases that cause increased albumin. Another type of protein are immunoglobulins, right? Which is basically your IgA, IgE, etc. Right? So now, what disease would make a lot of immunoglobulins? Multiple myeloma, right? Okay, now what is multiple myeloma? It's basically a disease state that increases the production of plasma cells. It's a cancer, right? Leukemia, a type of leukemia that causes a lot of plasma cells. And we know, what do plasma cells create? Immunoglobulins, right? They create immunoglobulins. So if I have multiple myeloma, what would I expect the oncotic pressure to be? Probably higher than normal, right? Compared to a normal individual, an individual with multiple myeloma would probably have higher oncotic pressure. And I know the USMLE Step 1, it's really well known to create questions that have, theoretical stuff in there. It's stuff that you've never really heard of before, but then again, you can use these simple concepts to answer these questions. They might ask you a question, well, which of the following options has which of the following diseases has the highest oncotic pressure? And you think, well, I mean, I've never heard of this before. I've never read this in any of my books before. You just think really, really simply. Which of these, what's oncotic pressure? Protein, and protein is equal to immunoglobulins. Multiple myeloma would be a fitting answer. Although you've never done that question before, you've never read it in a book. Okay.